My name is Jessica Berlsman. I'm a clinical educator here at Advent Health Sebring for the Med-Surg departments. When they first brought Banyan in, I had a great experience. We had our representative that came on, and they were just very accommodating. They kind of went to all the floors to really get to know the staff and see our process before even introducing any major changes to the hospital. They helped us develop plans moving forward, just to help the staff to adapt better to a huge change. We even put, I believe, the staff through a series of courses on just accepting change, which was really nice. What helped them the most was having the support. I think what they were most apprehensive about was a major change, especially we went from kind of more one-on-one care to a more team approach initially, and we had to adapt that as we went. And I think just the idea of changing our whole ratios and our whole approach with care to the patient was the kind of scariest part, so to speak. But being as hands-on as everyone was, we were able to move forward a lot smoother. So for Banyan, they went to the bedside with the nurses and followed their processes before and after the change. Getting hands-on as well. When all the equipment was brought in and set up, we had trainers come in and sit side by side with those nurses, and just walk them through the process. And then even when we had live patients, they stayed in-house. If it was the management team, me, Banyan, um, staff that was just more experienced, we had maybe, like a super user, so to speak, that learned the process and kind of sat with those nurses as we trained everyone, and got them more comfortable with the process. So what I like best about the virtual nurse process myself, especially when you're working the floor, is just that they kind of close the loop for us. When we get a new patient, they're able to communicate with the charge nurse on getting that patient in the bed, going in there, welcoming the patient, starting that paperwork that is a nuisance. They kind of pick up the tasks, all the extra stuff that makes the job way easier for us on the floor, as well for the nursing staff. And why bring virtual nurse process on? My immediate response would be, nurses have a hard job and staffing is not getting better. And if we can have some assistance in some kind of other way, maybe through a virtual nurse coming in and checking on the patient every hour, picking up those paperwork items like discharge processes, admission forms, education with the patient, if they can pick up some of that slack to relieve it from their nursing staff, you're going to have much happier staff. You're going to have better ratios because they're picking up some of that slack, and that frees up the nursing staff on the floor for other things. And Banyan as a company is a very supportive company and willing to do whatever it takes to make it work for their company.